I will be talking to you guys about my journey and how empathy has inspired me to take action and create meaningful change for underserved communities around me. And my presentation is going to be a little different. I'm going to talk about my nonprofit and the work I've done and how expanding that has also led me to find new avenues where I also follow that same message of creating change for underserved communities. So just a little bit about me. I'm a senior undergraduate student at the University of Washington and also an aspiring physician. A lot of my exploration in the medical field has included a wide range of experiences from research and clinical work to also community service and mentorship. I was recently honored with Husky 100, which is a distinction for 100 students at the University of Washington who has made the most of their time in and outside the classroom. And throughout my whole journey so far, I've had a deep commitment to equity, compassion, and understanding to really serve the people around me. So that commitment led me to start Lift the Spirit. I started this nonprofit in high school and with the one goal of improving the quality of life for special needs children. Growing up, I always had special education classes around me and people with disabilities that I didn't feel that I was close enough with. I wanted to understand them more to help them, and that led me to this nonprofit where I create tools, I help build skills, and also provide emotional support for people with disabilities to reach their full potential and also create these comforting and inclusive spaces for them to thrive. A few months after I started my nonprofit is when the COVID pandemic hit. And so that wasn't the most ideal situation, but we made it work. And talking to special education teachers and the parents of those with disabilities, I realized that the pandemic caused a situation where their primary source of interaction, engagement, and communication was gone. And a lot of them struggled with switching to virtual learning and sitting in front of a screen and trying to comprehend what was being taught to them. And so to combat that, I started a project called Share to Care, and we gave kits that included iPads loaded with a lot of ebooks and activities like coloring pages, word searches, and also writing prompts or talking prompts that they could engage with by themselves or with their parents. And we also made sure that we were going through what the parents wanted, the goals they had for their children, and addressing that in the same way. And the success rate for that was very great. Everyone who utilized these kits had an increased amount of engagement, and the teachers at the special education classes vouched for them, saying that they were able to be more engaged on the screen and stay there and be very aware in these situations. And also all of them improved in their reading comprehension skills drastically. And finally, when the pandemic stopped, we were able to branch our mission to multiple high school chapters, and these are all schools in the Bay Area, one of them including my high school. And we were able to start these programs called Student Pen Pals, where high school volunteers would then be partnered up with students with disabilities in their special education classes, and they would foster a connection, and they would build these inclusive environments by meeting once a week and just doing activities that they liked, or writing letters if they wanted to improve writing and comprehension. And so they very much tailor it to the individual they're working with, and they're able to foster these very comforting environments where they also fundraise for them and also have these big community events where they'll rent bikes and have all of the class students participate in that as well. So I've had a lot of personal experiences kickstarting Lift the Spirit as well. During the pandemic, I heard the concerns and voices of the parents and special education teachers and wanted to take action myself against that. And that's when I started one-on-one Zoom sessions. And there was two very predominant impact stories that I had from that. One of them was a student named Alice, and she was 22 years old, which is the cutoff age for public high schools and staying within these classrooms. Her parents were very concerned on how they would communicate and engage with her when they're full-time at work and what her life would be after. And that's when we started texting every single week for over a year, just an hour texting sessions that allowed her to then be able to text her parents independently. And ultimately that resulted in her parents having the reassurance and confidence to send Alice to a special needs center where she's currently now thriving and learning every single day. Another story is a boy named Colin who struggled with autism. Virtual learning was a very hard time for him. He struggled engaging and really, he couldn't even sit in front of the laptop for more than an hour. So it was really taxing on the teacher and also his parents, who also were working full time through all of this to support him. We had our Zoom sessions once a week as well, and it started off a lot rockier than Alice. I had to really get to know Colin, his interests, his passions, what books he liked, what shows he liked to watch, and I utilized that to personalize all of our Zoom sessions to help him with communication and engagement and confidence. I performed similar Zoom sessions during COVID for younger children with autism, ADHD, and other cognitive disabilities in collaboration with Stanford, and that definitely taught me a lot more on how to communicate with them, how to engage with them, and get these telltale signs of when I should switch a topic or change up what I'm doing to make them more comfortable. And additionally, once COVID ended as well, I became a teaching assistant to see how their classrooms operated. So I was aware of the best ways to help them and the best ways to put my foot through the door and make a real difference. And each interaction taught me about new issues to combat and new problems that are very relevant to their field. And I realized that the group that I wanted to target the most was that age range between their last few years in high school to life outside. It was very unknown, and there wasn't that many resources to help them. And so I'm currently working on a couple things right now. I want to implement safety and social curriculums in special education classes so their transition to outside life is a little bit easier. I also want to create job support programs for people with disabilities so that they have a sense of belonging and a sense of purpose coming out, and something that they can be independent for and have the confidence to do. And lastly, a big important part is having safe and secure housing for those who need it, and also centers where they can continue to grow and learn outside of school. So to switch topics here a little bit, my nonprofit taught me so much. It taught me how to be more personal, professional, and also gave me leadership experiences and problem-solving skills. But going into college, I was on this pre-med track, and I was getting more exposure into the medical field and being more hands-on with the community around me in different avenues. And I realized that this big problem was overlooming within all the fields I was serving, which was healthcare access and healthcare inequalities. There was many underserved communities, from unhoused individuals to the special needs families that I was talking to and more, that faced all of this economic hardship and poverty, which was one aspect of this inequality, and also stigma and cultural and language barriers that was also a big impact. For example, the parents of special needs children always communicated to me how they often felt unheard and overlooked in the medical field due to stigma and also the lack of resources and interventions that were available to them. And I realized that the empathy that drove me to start my nonprofit Lift the Spirit could be continued to serve different avenues. And that's when my path expanded a little bit. So as a researcher, I began understanding how inequities in representation and access shape who's really benefiting from scientific progress. And that was really relevant as I do research in ovarian cancer, which is one very female dominated, another there's not a lot of research on different races, and so there was a lot of issues there that I was identifying. As medical scribe, I saw the disparities firsthand. I saw people come in and have delayed access to care due to not having insurance or being homeless and all of these different problems. But I was also able to join student organizations at the University of Washington to give back to the community in other ways. I was expanding my nonprofit on one hand and continuing that and making sure I was making an impact, but I could also put my foot in the door into other nonprofits and organizations that many of you guys hear. So just to go briefly through some of these, I work in the emergency department at Overlake Medical Center in Washington, and I have learned from the healthcare teams how to approach every patient with empathy and compassion and understand their stories to treat them better. And I've also been able to have publications where I'm making unique cases that aren't really heard of aware to medical specialists, and so that they can look back on it and reference it if they ever have something similar. I'm also very grateful for my research lab that I've been part of since the beginning of college, where they allowed me to do my own independent project on ovarian cancer, and I hope that the outcomes of that will be very relevant in the findings of early detection methods that can help many people after. And most importantly, and the most relevant here, student-run organizations. So these are 3 that I'm part of, but college is big. There's a lot of organizations, and I could list 5 more that I'm part of, but these are the big ones that I have been able to do the most good for my community. For example, in NARCare, we give Narcan to unhoused individuals in Seattle. It's a big problem. There's a lot of overdoses, and being able to go directly to them, hear their stories, go to homeless shelters and provide them with healthcare access that they didn't have before. A lot of them have witnessed overdoses but didn't have Narcan to provide to their friends. And there was a lot of personal stories that I heard, and we are actively raising awareness for that and fighting against it. Perfect Pair, I know we had a nonprofit which was serving seniors, and this is a little similar. We try to combat that isolation and loneliness that senior care homes have and the residents feel. And just by going there, throwing events, and even if it's just like they're writing letters to their friends who are long distance, or they just want to paint pumpkin plates. Like, very small things really make a difference, and their impact is very heard just by seeing the smiles on their faces and how excited they are to be there. And lastly, We Care, a little also very different as well. As common theme, there's a lot of different avenues that I've been partaking in. But through We Care, we provide HIV vaccinations to underserved girls and child brides in India, in rural India, who don't have healthcare access, who don't have education, and that has been very successful. We work with foundations there, and about 90% of the girls who are at these centers are vaccinated now. So that concludes my talk, but I want to leave you guys with a couple key messages that most of you are probably aware of working in the nonprofit space, but I think the viewers would definitely benefit from. Every story matters. I think everyone here has had an impactful story that you've realized makes a big difference and continues our drive to do more good. And we have a lot to learn, so I encourage everyone to take the time to talk to different people, diverse communities, and I promise you there's so much to learn from them, and we will grow as people and learn so much. Additionally, empowering one voice empowers us all. My nonprofit started with me taking out recycling with a special needs child. It was very simple and it was very small, but I saw the impact it had, and that just grew and grew and grew. And that can be done by volunteering, getting involved with your community, and also even bigger things like innovations and methods to help. And lastly, partnerships are essential in creating lasting change. There is an infinite amount of ways to get involved. There's so many organizations that are ready to have you and ready for you to contribute. And I encourage all of us to step out there, volunteer for different organizations, and do better for our community. So that finally concludes my talk, and thank you so much for taking